Yeah, so just prior to the current ongoing ASTRO meeting was the Radiation Research Society meeting, where we presented again a study looking at a germline, so an inherited gene alteration that predicts for response to hormone therapy. And so this is an alteration in a gene called hydroxy-3-beta steroid dehydrogenase 1, HSD3B1, produces an enzyme or codes for an enzyme that metabolizes adrenal steroid hormone precursors and turns them into potent androgens like testosterone. It's the rate limiting step in that conversion. And so, as you might imagine, for a cancer like prostate cancer that is driven by high levels of testosterone, the ability for either tumors or in the adrenal glands for the conversion of these precursors into more and more testosterone may not be a great thing for prostate cancers, which we're trying to treat with hormone suppressing drugs. And so what the study that we looked at, which was really built around the work of my colleague Nima Sharifi, who characterized a polymorphism or an alteration in the HSD3B1 gene that men with prostate cancer are likely to inherit, which can promote their likelihood of developing hormone therapy-resistant disease. We asked the question whether or not this alteration is promoting resistance to one of the primary ways we treat prostate cancer, which is radiation therapy to the prostate. So in early stage and localized disease, does the type of HSD3B1 that a patient inherits alter their likelihood of responding to the combination of hormone therapy and radiation that is often used in patients with high-risk prostate cancer? And the answer was that yes, indeed, the levels of HSD3B1 associated with your germline genotype for this gene, which allele you inherit, do drive differences in sensitivity to radiation through a hormone therapy-dependent upregulation of DNA damage response, which we know contributes to resistance to radiotherapy. So that's a mouthful, and I'm getting kind of into the weeds of it, but I think the key takeaway point here is that again, as we've talked about, there's molecular profiling of the tumor, there's imaging and non-invasive diagnostics that can tell us about patients' risk. Here we're looking at germline or inherited alterations that can predict whether a patient, or might be able to predict whether a patient can respond well to a common therapy for cancer, which is radiation therapy. And so we're really taking a multi-pronged approach, looking at features of patients, features of their cancers at a really granular molecular level to identify those changes that can better predict which patients will respond to what treatments.